From the Toronto Star, I'm Adrian Chung, and this matters. As we record this, a majority of Canadians, about 58%, are heading into a one-dose summer. What does that mean for how we live now? We're definitely not post-pandemic yet, but with lower case numbers and higher vaccination rates, life is beginning to reopen. Gathering limits are growing, outdoor gyms and pools spring back to life, patios are popping up. In Ontario, the province is moving its Step 1 reopening plans 3 days early.
Well, I can tell you that that's something that we're looking at. We're still looking at the numbers, and the numbers are looking quite favorable.
But there are still many questions and uncertainty about what's next. Could this actually be a two-dose summer? After the mistakes of the past, what does a safe reopening look like? And what needs to happen? What kind of bar do we need to meet before we can finally travel again? On This Matters, we're joined by Dr. Fahad Razak, internist and epidemiologist at St. Michael's Hospital in Toronto, and a member of Ontario's Science Advisory Table. Here's your summer guide for the months ahead and what reopening really means. Dr. Razak, thank you for joining us and making the time.
Good to be with you, Adrian.
Let's start with some good news, because I do think that there is a decent amount of that these days. 58% of the Canadian population has at least one dose. In Toronto, that number goes up to 70% of the adult population that has gotten its first dose. Case numbers we can see are dropping. I know we have been cautious about this, but is there a pretty good case that we have seen the worst of the third wave?
Yeah, I think it's really important to recognize how far we've come. So working in the hospital over the last couple of months and working on our COVID wards at St. Michael's Hospital, things were very, very tough just a few months ago, and we've made significant progress. And part of that progress is from vaccination, undoubtedly, but we have pretty good examples globally now that vaccination alone would not have resulted in the dramatic drop that we're seeing in terms of COVID cases, hospitalizations. It's really those public health measures as well, which have been the very difficult burden for people in the country.
What are your thoughts on Ontario's reopening plan? We've seen that it appears to be pegged to both vaccination numbers, the uptake, and then also weekly case numbers as well. We've seen the different stages of reopening. Do you think that that plan is based in good science?
Yeah, I think what you saw in the initial rollout of the reopening plan was a lot of praise from scientists and health system leadership around the fact that it was multidimensional. It included things like case rates, percent positivity, hospitalization, and healthcare utilization, along with important targets like vaccination percent. It was also cautious. It said that there's going to be a staged approach that took, multiple weeks before progression from each stage of the reopening plan. Now, obviously, there was a recommendation from the science table that part of the strategy around how to reopen should include getting schools open first, before other sectors even, and really treating schools as the single priority. That didn't happen as part of the policy. So I think overall, the reopening plan is something that there was broad support around. Many of us would have liked to see school reopening be an early priority, and that doesn't look like it's going to happen.
Does it appear, though, that we as a province have perhaps learned lessons from the past? And I'm thinking about last fall and to a certain extent this spring, too. Frankly, it was botched. Does it seem that, lessons are being learned here?
I think so. I think you have seen responsive policy that have learned from the prior waves of the pandemic. Obviously, there's always room for improvement, but I think you have to acknowledge that, for example, this reopening plan by and large was science-based, and it is responsive to the fact that we didn't get it right earlier times, and especially the wave that we've just gone through, that really stacked on top of a second wave that hadn't even resolved before we really started to see the surge of the third wave. And that's really what put our health system in crisis. And, for those of us who have been working in hospitals for a number of years, there's really been never an experience like what we just saw in the last couple of months, airlifting thousands of patients across the province, the admission rates, the strain on healthcare workers, running out of drugs. This was really a dramatic, and really for most of us, I don't think we would have ever imagined seeing something like we saw over the last couple of months. And so I do think that there have been real lessons learned. And one of them is that things can rapidly go in the wrong direction. This is a virus, like many other viruses, that grows exponentially, and your window of action to get it right can be very small.
So, as we're starting to turn the corner a little bit now, when we're talking about reopening, when we're seeing things change and sort of inching towards what we can classify as our normal lives, I've heard epidemiologists say that when we're talking about reopening, a safe reopening, that judging purely on case numbers really only gives us part of the picture now. So, in your opinion, what metrics, what criteria should we be looking at when we're talking about doing this the right way?
Wide range of parameters have been proposed, and I would say there is actually very little consensus to say that there's a single number of metrics that you can use to say, if you follow these three numbers, you're going to get it right. What are the things that people broadly consider? So things like case counts, percent positivity, because that really tells you about the underbelly of who's being tested as opposed to who's not getting tested, hospitalization rates and ICU use, and then vaccinations as a general protective mechanism. If you look at those parameters, most of them are moving really in an impressive way. They're moving in the right direction. The one area that has lagged significantly is our ICU capacity. And if you look at our ICU numbers right now, even though we've had this dramatic improvement in case rates and the decline in hospitalization has been precipitous, our ICU numbers actually are still roughly at the peak of the second wave. Why do we care about that? So when the ICUs are that stressed, it means that there's a spillout on other things like a heart attack or cancer deterioration, trauma-related admissions. Those things also get affected when our ICUs are really full, but also because of the hundreds of thousands of surgical and procedural backlog that we have in the province right now. In order to start to catch up on those effectively, you need our ICU space open enough that it can accommodate patients that come in. And so that's really the one area that's lagged. I think reopening is still very realistic, reasonable. It's going to happen, but we should not forget that one number, that our ICU capacity, in fact, still looks pretty bad.
So there's obviously a knock-on, almost domino effect when your ICUs are full and still, there are a lot of people in it. There's an effect on the entire healthcare system.
That's right, because that ICU system is really our safety net. When we admit someone to hospital, let's say on the general medical wards where I work, our anticipation is we're going to be able to treat them and get them out of hospital. But for a small percentage of patients, they're going to get sicker and they're going to need that safety net of the ICU. And I'm not just talking about COVID. I'm talking about the pneumonia admission. I'm talking about obstructive airway disease or asthma. Any of these admissions, we need that ICU backup. What happens if there's a car accident, someone has to be trauma lifted into our hospital? Do we have the ICU capacity to care for them? That's the number we should still really care about. It's not just about COVID. It's about really how the entire acute healthcare system works.
We'll be right back. So, looking towards the reopening then, there's that tagline that everybody knows by now, one dose summer. The Ontario government has said that this could even be a 2-dose summer or end of summer. In your view, based on the epidemiology, what does summer look like to you?
I think rather than having a single dramatic point of reopening, it's going to be a slow transition. And you're really going to be caught by the fact suddenly that you realize you're doing something that you couldn't even do a few weeks earlier. It's going to be that you're out to dinner with friends. You're outside, but you're still out to dinner with friends. So something has meaningfully changed. Or you're getting together with a larger group of family in an indoor setting where everyone's been vaccinated, something that you haven't been able to do for most of the last 15 months. It's going to be these slow steps forward. I don't think there's going to be any dramatic point where we suddenly feel like we've reopened fully. At the same time, the vaccine effect is going to be pretty dramatic. So if you look to the US, the Center for Disease Control have put out guidelines that if you are fully vaccinated, and fully vaccinated means that you've had both doses of the vaccine and you're roughly 2 weeks after the second dose so that your immune system has really ramped up to protect you. There are a lot of things that you can do that really we've almost forgotten to do at this point. You can sit inside with people without a mask as long as everyone else is fully vaccinated. You can travel domestically without getting tested or quarantined during that travel. There's a lot of things you can do once you're fully vaccinated and when a lot of the population has been fully vaccinated. That's the good news. Now, where's the concern? So a lot of the media coverage the last few weeks has been around the Delta variant. This was previously called B1617 or the Indian variant. It's especially of concern because it is ramping up right at the time where our specific strategy, which was this one-dose strategy, has already given us a lot of the benefits, but it did have certain risks. And the risks were the emergence of a variant, which doesn't respond well to just one dose of vaccine. And that's exactly what the Delta variant is. And if you look at other countries, and I really think that the United Kingdom is really a crystal ball for Canada, they're always a few weeks to a month ahead of what we're seeing here. You're seeing this rapid rise of the Delta variant. It's now the dominant strain in the United Kingdom.
NHS chiefs say the number of people in hospital with the Delta variant of COVID is going up, but not yet by a very significant amount. One expert has warned that going ahead with a full reopening at this stage would be a major risk.
We specifically are at risk for that because we have followed the UK strategy, the one-dose strategy. And clearly the Delta variant is not as responsive to just one dose of vaccine.
Right. So it does seem like, again, there are reasons to think that we are turning the corner, that things are quantifiably getting better. But as you mentioned, ICU numbers are still pretty high. We still have to think about the variants, that it's not just a clear shot towards getting out of this thing. There are still points to worry about here.
Yeah, absolutely. One of the health system leaders, David Naylor, he uses the expression patience and prudence around how to respond to COVID. And I really think that should be our mantra around this. There shouldn't be a rush to reopen. It should be staged and it should be monitored carefully. And we need to be nimble. So one of the lessons from the past 15 months has been that if you are slow to respond, things can dramatically change. And so as we have this reopening, the Delta variant is a great example. It's already surging in the Peel region. We had a strategy that rolled out the second dose of the vaccine that was really based on age. We're clearly seeing a regional surge in the Delta variant right now. It is a hotspot. We have to adapt. And the adaptation in this case would be reroute the second doses to the hotspot to address the area where rapid spread is occurring. That would not have even been a recommendation 2 weeks ago, but it's clearly the right thing to do today. So it's that kind of nimble response to policy. It's very hard to do. There's clearly stakeholders on both sides. When you take that vaccine and you route it to the Peel region, you're taking it away from someone who's waiting for a vaccine. So these are bad options, but that ability to be nimble is really crucial if we want that sustained reopening.
I question whether or not I should even ask this because, again, things keep changing week by week. But obviously, a lot of Canadians have looked towards, our southerly neighbors in the U.S., as you mentioned, where a lot of things have begun reopening up. They are not quite post-pandemic, but they're moving towards that normal is much more of a constant state for them now. You see stadiums full and they're reopening some indoor dining. And of course, a lot of Canadians are wondering, especially if they have one dose, what does the state of travel look like? Is it safe to travel even if you only have one dose? At this stage in time, again, we're recording in early June here. What do you think? Should we even be talking about that right now?
Yeah, I'll say one thing up front, which is that the United States is dominant in our perception of what is right or wrong for many things, not just COVID. And, we need to acknowledge that as bad as it was in Canada, even at the peak of our third wave, the United States experienced numbers that were 3 to 4 times higher than what we saw in Canada. So I would say we should be very cautious about looking to the United States as a policy environment or a way out of the COVID pandemic that we necessarily want to emulate. That said, clearly you can see some of the benefits of having that second dose of vaccine into people, something that Canada has yet not achieved. So yes, we are surging in terms of first dose vaccine delivery. You'll see a lot of trumpeting of the fact that we are atop the G20 over the past week in terms of the percentage of people who've received that first dose. But if you look at Canada versus, for example, the United Kingdom or the US in terms of second dose, in the US, roughly 40% of people have already received their second dose. In Canada, that's only 6%. That is an enormous gap. That's going to take months and months to catch up on. That second dose, again, becomes especially crucial because the variant that is spreading rapidly now, the Delta variant, requires that second dose to be properly protected against. And back to your question, that is going to be the reason why a single dose will not allow you to travel safely. The Delta variant is surging clearly across many parts of the country right now. It's probably going to become the dominant variant within Ontario within 1 to 2 months. You are not protected against it if you've only had one dose. And furthermore, even with the older variants, we know that important groups in society, the elderly, people who are immunosuppressed because they have cancer or they're on different medications, those people are also not protected by one dose, even against the older variants, let alone the new Delta variants. So That's the problem with one dose. It protects you as a society. We've had these cases come down dramatically, but for each individual in society, it doesn't give you enough reliable protection to change your behavior. So unfortunately, the travel restrictions, the social gatherings, all of the things that we've said you have to be cautious about, one dose doesn't get you past those barriers of caution. You really need 2 doses and full immune protection.
So that one dose summer, on the flip side, almost there could be a false sense of security there. That until we get those 2 doses and a substantial part of the population gets those 2 doses and are fully vaccinated, we can't really compare ourselves or think about reopening in some of the same ways that we've seen in other countries, is what you're saying.
Absolutely. And, I think a good example would be Canada itself in the summer of 2020. We did have some degree of reopening, but we failed to catch the surge that led to the second wave in enough time to blunt it. So can we have a significant amount of reopening in the summer? Absolutely. I think most of us hope for and believe that you can have that. But individual behavior from just that first dose of vaccine, you can't dramatically do something different than you were doing even before you were vaccinated. You really have to wait for that second dose. That doesn't mean you can't have a reopening. Stores can be open, restaurants can be open, people can be, especially outside, which we know is much safer than being inside. Enjoy that Canadian summer. But it's not the same as being fully protected. And that kind of leap is going to take quite a while to occur, and it's probably not going to occur during the summer.
Do you think it could be good public policy? And I ask this because there is a flip side to it, but there is this idea around vaccine passports. Again, I'm looking towards the US when they do that it has been experimented at a state level there. Do you think that as vaccination levels keep increasing in Canada, whether it's first dose percentages, whether it's people getting their second dose, is that something that could be considered here?
Hotly debated, and I would say the science is still emerging around how effective a vaccine passport can be. That said, it's going to be the reality in multiple parts of the world. The European Union is considering vaccine passports. It's being considered across multiple parts of the United States, as you mentioned. And so I think there is a realization in Canada that some kind of systematic documentation around vaccine or immune status, so if you've had COVID and have also recovered, that would be the other thing to consider, is going to be required for Canadians, probably for international travel. It's probably something that's going to be required. Now, there are concerns around vaccine passports, and a lot of them fall around equity lines and along civil liberties and human rights. So what happens if someone isn't vaccinated? What kind of exclusion do they experience from society, from access to essential services or essential care because of their vaccine status? That's largely not been worked out. There's going to be a legal element to this that has to be tested in the courts. So if someone refuses to get vaccinated and they're excluded from certain essential activities, is that legally allowable? Unclear. It's going to be tested. But probably some kind of formal vaccine documentation is going to become the norm globally, at least among many of the countries that Canadians would be interested in traveling to.
Yeah, definitely so much more than just health policy when we're talking about vaccine passports. There's so many different elements that we have to consider as well. Dr. Razak, I wanted to go back to a question that I asked you a little bit earlier. When we're thinking about the one dose summer, for most of us, that is the reality. The hope, of course, is that we're getting closer to 2. As things begin to reopen and things start to shift and we're gradually getting closer to, as you said, like little moments where we're eating at a restaurant, or maybe we can finally see some of our family members later into the summer. But again, for most people who have that one jab, what would you tell them? What should they know about their safety? What should they be doing to keep themselves and others safe this summer, you think?
So I would say that getting yourself vaccinated, first dose and then second dose as soon as you're eligible, is one of the most important ways that you can protect yourself. The second is outdoor activities remain one of the most safe things that we can do in terms of limiting your risk of viral exposure. So if you are going for a walk with someone outside, if you're sitting around a picnic table, but have a little bit of space between you, those are things that are much, much safer than indoor gatherings. So those are the kind of activities that are probably going to be the safest things to do, along with the protection that being vaccinated gives you. In terms of risk, if you have individuals in your family that are high risk for having bad outcomes with COVID, the elderly, people who have compromised immune systems, helping them get vaccinated is really important. And you're starting to see a shift in policy already to allow them to get that second dose faster. We're seeing that, for example, with the age ranges dropping. So that's going to be really important. Some of the biggest barriers around vaccination have not been the willingness of people to get vaccinated. It's navigating our complex vaccination system figuring out where to get that vaccine, how to register, helping people around you get registered. I think a lot of us have helped family members, we've helped patients. Helping people get registered to get vaccinated is really important. I think that numbers will come down. So if you look at Canada in July and August of last year, numbers were less than a fifth of what we currently have in Canada currently. And a lot of activities had largely spun back up. You saw people outside, you saw people on patios, people were at the mall, people were at restaurants. I think we will get to that state this summer, but it's really about getting us there as safe as possible. And so some of those individual strategies become really important, but also the rates of COVID in your community are a determinant of risk that you as an individual don't have a lot of control over, but are very relevant to the risk you're experiencing.
Dr. Razak, thank you so much for your time, and it was great to talk to you. Thank you for breaking that down.
Thanks, Adrian. Really great to be with you.
And that is Dr. Fahad Razak, epidemiologist and internist at St. Michael's Hospital in Toronto. Dr. Razak also serves as a member of Ontario's Science Advisory Table. That's it for today. Thanks for listening. This Matters is hosted and produced by me, Adrian Chung, Saba Aitazaz, and Raju Muthar. Produced and mixed by Sean Pattinen, and our director of programming is JP Fozo. Our show theme music is by So Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.